Good morning. It's such a pleasure and an honor to be able to have you here at this announcement today. This is a very exciting day for us to be able to announce a unique partnership amongst local, state, and federal partners. Also, the successful braiding of public and private dollars to ensure that our essential workers and their children have access to quality child care at this very critical moment. It is with distinct honor and privilege that at this moment I have the pleasure of introducing the Mayor of the City of Houston, Mayor Sylvester Turner.
Thank you, Julius DePatch, and certainly I want to thank all of the participants who are here today, and it's always good, again, to be standing with County Judge Lina Hidalgo. We've been spending a lot of time together, and so let me thank Judge Hidalgo for her leadership. We also have the pleasure of having Congresswoman Sheila Jackson Lee from the 18th Congressional District. And then I want to also acknowledge Melanie Johnson, who's with Collaborative for Children, President and CEO. Thank you for your work. Richard Shaw, who's here, the committee chair and labor representative for the Gulf Coast Workforce Board and Workforce Solutions of Harris County. And then there are a number of other parties who are here. I do want to acknowledge Marissa Aho, who's with the City of Houston, the Chief Resilience Officer. I want to thank those who keep the city running, and I know the judge will be thanking those who keep the county running. They include our first responders, healthcare and public health employees, metro bus drivers. They are essential government workers. Also grocery store employees and delivery workers, construction workers, all those who work in critical infrastructure as identified by the U.S. Department of Homeland Security, National Cybersecurity, and Infrastructure Security Agency. I recognize the challenges that you and your family face in these most difficult times. There is no playbook for a pandemic. Essential workers have kept our city and county operating since the beginning of this healthcare crisis. On any given day, finding quality child care is critically important for parents who work outside the home, and today this issue is further complicated by the fact that many of our most reliable systems of child care, from local public schools to child care centers, are challenged by COVID-19 closures and a great deal of uncertainty. We recognize the need for our valiant workers and public servants who must report to work to maintain Houston's and Harris County's essential services to easily find quality child care. To better understand the needs of our public servants at the City of Houston, I issued a citywide survey to identify the child care needs of employees with dependents 12 years of age or younger. I was overwhelmed by the rapid responses calling for a system to connect parents with child care options for infants, toddlers, children, and adolescents. In response to this unique challenge, the City of Houston's Mayor's Office, including my Office of Resilience and Office of Education, partnered with the Houston Endowment and Harris County Judge's Office to develop a child care solution for essential workers during this emergency. They coordinated a diverse group of public, private, and nonprofit stakeholders to develop a strategic child care plan and created a streamlined process for essential workers to find child care and apply for financial support. Today, we are pleased to announce that families of essential workers can register for child care and for financial support online at findchildcarenow.org, and that's now with a capital N, findchildcarenow.org. All essential workers, including all of the City of Houston and Harris County employees with children ages 0 to 12, are eligible to participate on a first-come, first-served basis. Once a family selects a center and the enrollment is confirmed, care can begin immediately. We have partnered with Collaborative for Children, a long-standing, respected nonprofit with over 30 years of experience in helping families find childcare, and Workforce Solutions. Collaborative for Children will contact applicants within 2 business days to help find them a quality, licensed child care center that best serves their needs. And if a family wishes to apply for financial support, they will be contacted by a representative from Workforce Solutions within 4 business days to review options. Workforce Solutions has allocated $10 million in for child care for the 13-county region of Austin, Brazoria, Chambers, Colorado, Fort Bend, Galveston, Harris, Liberty, Matagorda, Montgomery, Walker, Waller, and Wharton counties, which can provide child care support for at least 3,500 children of essential workers. I want to thank the nonprofit and philanthropic leaders who have come together to support quality child care for our essential workers at this time. And quite frankly, I don't believe that there is a similar program any other place in the United States. I especially want to thank Tanyelle Edwards, Program Officer from the Houston Endowment, who has worked very closely with Chief Resilient Officer Marissa Aho and Director of Education Juliet Stepech to support this effort. A very special thanks to Workforce Solutions, Bain and Company, Collaborative for Children, United Way of Houston, the YMCA of Greater Houston, First 3 Years, Harvey Home Connect, Texas Public Lab at Rice University, the Bridgespan Group, and the Baker Institute at Rice University. These are challenging times, no doubt. But together, in Houston and Harris County fashion, we will get through this because we are, as we've said, hashtag Houston Strong. Juliet?
Thank you, Mayor. Before we proceed, I wanted to say that we have a wonderful ASL interpreter here. He's not wearing a mask because he needs to be able to demonstrate what we were translating at this point. So just a huge round of applause and thanks for your interpretation at this time. Also now I have the distinguished honor and privilege of being able to introduce the Harris County Judge, Lina Hidalgo.
Thank you so much. Juliet, before I begin, I'd like to share a sad milestone that we've crossed in Harris County, and that is right now in all of Harris County, including the city of Houston, we have just over 1,300 diagnosed COVID patients. So we crossed 1,000 a couple of days ago. Deaths have now very well entered the double digits. We are at 20 people who've had their lives stolen by COVID-19 so far. Across our region, beyond Harris County, over 2,000 people have tested positive. And I want to be real with people. I don't think that these numbers truly represent where we are. I believe, and those who are looking at the hospital data believe, that the numbers are much higher than this, that for every person who is diagnosed, as we've been saying, there's probably a few, maybe up to 5 who've not been diagnosed. It's been a challenge because we don't have the access to testing materials that they do in other countries, and so we can't possibly test enough people to have a fully accurate count of who exactly has the virus. And so it's time to remember just how important all of our work together is. To those of you staying home, I want to say thank you again. And those of you that are not, and really it's not too many, but they're still out there. I know Palm Sunday was this past Sunday, and anyone who went to spend time with people not part of their households, you put them at risk. If you go see somebody who you do not live with, you are putting that person at risk. And so we have got to continue to take personal responsibility for this, because the reality of it is the sooner this virus can be controlled, the sooner we can go back to our lives, the sooner the economy will recover. And if if we don't put our foot forward, our effort forward, this will last longer, the economic downturn will sink deeper, and it will be harder for us. Much worse, we will face the type of crisis that we're seeing now in New York, in other areas across the country and the world, and we can still avoid it, so we need everybody to do their part. If you absolutely have to be out, and that means essential workers, that means if you're out making a run to the grocery store, you're out making a run to the pharmacy, you've gone to the park to be away from other people still, and that's pretty much the only reasons why folks should be out and about. We are asking folks that they wear a face covering. The CDC issued new guidance that even folks who are asymptomatic may still end up spreading the virus through even talking, sneezing, coughing. They may have the virus and not know it. So if you are out in public, you should be wearing a face covering. Now, the other guidance that we received, and that's why I've brought this one, and I don't have it on because you can't hear me if I put it on, so that's why I'm speaking with it around my neck. But if you are able, please do not buy hospital or N95 masks. As we've seen in New York, we're already seeing doctors that have to use homemade masks, that have to use less than perfect solution because there is a run on the hospital masks. And so if you are able to access, I had this one made by somebody who gave it as a gift, and so I'm going to be wearing this one. And folks who would like to make one or understand how to wear one, how to wash one, etc., you can go to readyharris.org, and the guidance is there. But we do ask everyone who's out and about to please wear some sort of a face mask, and ideally to not have it be the kind of mask that our hospital workers are going to need. So that's a N95 or a hospital surgical mask. Let me be clear, there is no substitute for social distancing. And so even though you're out and about wearing the mask, you still should stay away from other people, and hopefully the mask will help remind us why we are staying away, why this is not the time for a pickup game of basketball or anything that has to do with touching surfaces or being close to people that we don't share a household with. Today, I'm so pleased to join Mayor Turner and everybody here on the announcement of this resource. We've seen shortages of medical workers across the country, and we can't afford to have a single medical worker or grocery store clerk or essential employee benched because they have to be home taking care of their child because they don't have access to child care. And so first responders, healthcare workers, grocery store clerks, other essential workers showing up for us every day, we have to show up for them. And what this effort means is that first, any essential worker who needs child care will be able or should be able to find it, and any essential worker who has found child care should be able to afford it. It is such a unique response from our region, so many folks coming together, Collaborative for Children putting together the portal, the Workforce Solutions, which is a state affiliate facilitating financial assistance, Houston Endowment providing funding, Bain and Bridgespan providing pro bono expertise, and of course the city and county. So folks can go to readyharris.org. That will link also out to the website the mayor shared in Child Care Now. And so anyone who is an essential worker can register for child care. Folks, the link is, and the information is also available in Spanish, and we're working to make it available in other languages as well. And folks will be paired with a child care provider. These providers are screened to ensure that they're following CDC guidelines for how to be as safe as possible with taking care of our kids. And folks who need financial assistance will also apply directly, will get support and access the financial assistance that they qualify for. Essential workers are our safety net right now. They are literally keeping this community together, keeping our supply chain going, keeping everything going, and so we need to make sure that we are there supporting them. I want to announce another program that is in response to a question we get a lot. You know, we've discussed our healthcare workers, their children, we've talked about each of us, needing to use a mask. oftentimes we are asked, what about our homeless population? We tell people, if you're sick, assume you have the virus, stay home. Really, you should be home anyway, and unless you're an essential worker. But what if you don't have a home to stay in? What then? And so we can't take for granted that the fact that many folks who live in homelessness do not have a place to go to. Starting this past Saturday, in a partnership with the City of Houston and various organizations, we have set up a system for folks experiencing homelessness to be able to access emergency housing. And so we have enough capacity right now for 60 people. It can grow. We've got capacity to expand, and we're basically working with the homeless shelters and with hospitals. If they identify somebody who is COVID positive or has symptoms and is likely to be COVID positive, they will refer these folks, and who are experiencing homelessness, they'll refer these folks to the program, and we've got the system set up. The city right now is providing the facility, the county is providing the wraparound social services, and we are basically providing support for folks to be able to stay in isolation while still being fully supported. And so anyone who knows of this issue, they can call our nurse hotline on Ready Harris as well and be referred, but right now we're working very closely with the homeless shelters and with the hospitals in this response. Another quick note, you are going to begin seeing trucks at our NRG complex. We are moving forward at the county with establishing a medical shelter, and that's what we need to call it for the purposes of our relationship with the federal government on this. So the federal government is supporting, and they'll support through reimbursement, ideally, what we are building, and that is a medical shelter that is to be used as a last resort. We hope that we don't get to a point where we need to use it. That would mean that our hospitals have used up their capacity, have used up their surge capacity, and now we'll have to use the capacity we're building at NRG. We're, in the meantime, going to find what other uses we may have for it, and so we're working on that. But so far, the construction will start right now in the parking lot of NRG. We right now can't build it indoors because, of course, we're still cleaning out from the rodeo. And so that would be a dangerous situation for anybody with respiratory illnesses to be around all of the materials that are necessary for the rodeo. So it's being stood up outside, and I just wanted to give folks a heads up. That's what you'll see if you drive by or you're by NRG. That's coming up, is this medical shelter that is something of a last resort. And the final note is just anybody who wants to support, just a reminder, you can go on readyharris.org to volunteer, to donate to the recovery fund that's been established. And there's another plug I want to put in today just for the Houston Food Bank. I know, Mayor, you toured their facilities this weekend. We've been in touch with the food bank, and they're telling us, they continue to need volunteers. You can access that through Ready Harris, but they also are in urgent need of financial donations. Not so much donations of food, but donations of money, so that they can be efficient in the use of those resources, purchasing the food that they need. And so if you will go to houstonfoodbank.org, if you're able to make a financial contribution, they need everyone's support right now to provide for our community. So I'll leave it there. I'll repeat my remarks in Spanish, and then I also obviously will be available for questions in the end. One more number, actually, that I do want to mention, and is we talk about we crossed 1,000 people who have been tested positive. I also want to note we are about to hit double digit in terms of the jail staff who have tested positive for the virus. At least 3 inmates are positive. 3 dozen inmates are now experiencing symptoms, and we expect we're pretty confident that quite a few of those folks will come back positive. At least 800 inmates are being quarantined as best we can do that within a crowded jail. And so we don't need a doctor We don't need to have a doctor here. We don't need to be a doctor to understand the jail has cramped conditions. This is going to spread like wildfire if we don't do something to substantially, quickly, of course carefully, but quickly reduce the population in the jail, because these folks getting sick are going to need the same hospital bed you and I may need. And so I'm very, very impatient, very, very concerned at the time that we're wasting right now on the jail. And I think history will remember people in two ways: those who took bold action to ensure that we are stopping the spread of the virus, and or those who dragged their feet or worse stood in the way. And so I sure hope that everybody is working in concert right now to get quick resolution going to the situation in the jail, because it's extremely, extremely concerning, the numbers we're getting just every day. I've gotten messages from family members of the jail workers saying they are so frightened to see their loved one go into work in these circumstances every day, and we've already identified nonviolent people who can safely be released after careful screening. En español, repito brevemente. Primero me gustaría nombrar una trágica cifra que ya cruzamos en el condado Harris. Son más de 1,000 personas que ya han sido diagnosticadas positivas entre el condado Harris, la ciudad de Houston. Claro, ya son más de 1,300 el día de hoy. Más de 20 personas han perdido sus vidas por el virus en nuestra región. Más de 2,000 personas han sido evaluadas positivas por el virus. Quiero ser muy clara, y lo he dicho antes, yo no creo que estos números, estas cifras, representen el total de los casos. Realmente no lo creo. Yo creo, y los expertos médicos nos dicen, que lo más probable es que por cada caso diagnosticado hayan 2, 3, hasta 5 más que existan, que sean positivos. Y el reto es el mismo. En este país no hemos tenido, y particularmente, sí, básicamente no hemos tenido el acceso a las pruebas como lo hay en otros países. Entonces eso significa que no hemos podido evaluar suficientes personas, y es lógico que el número de casos diagnosticados sea más bajo del que realmente debe ser. Realmente le agradezco a todos los que han estado en casa, que se han permanecido aislados, a aquellos que han salido, y son pocos, pero tenemos que reducir el número aún más. Sé que fue este domingo una fecha importante. Cualquier persona que visitó otras personas con quienes no viven bajo el mismo techo han puesto en peligro a esas personas, han puesto en peligro a esas vidas, porque podemos tener el virus y no saberlo, no tener síntomas. Entonces, por favor, recuerden no estar en contacto con ninguna persona con quien no vivan, porque si lo hacen, los están poniendo en riesgo. Entonces, seguimos pidiendo que nos ayuden con eso. Entre más rápido logremos controlar este virus, más rápidamente podremos salir de esta, regresar a nuestras vidas y también salir adelante en cuanto a nuestra economía. Si no colaboramos, si seguimos participando en actividades con más gente, el virus se va a extender, se va a expandir, y va a ser peor y más largo el impacto económico que todos estamos sufriendo. Pero si realmente tiene que salir, y eso sería si son trabajadores esenciales, si tiene que ir al supermercado, a la farmacia, al parque, básicamente esas son las únicas situaciones en las cuales debería salir. Entonces, lo que debe hacer es utilizar una cobertura para la cara. No estoy utilizando la mía porque no me escuchan si me cubro la boca, entonces la tengo aquí en el cuello. El gobierno federal ha explicado que si no tiene máscara, aunque no tenga síntomas, podría cargar el virus, puede contagiar a la gente al toser, al hablar, al estornudar. Entonces, al salir, por favor, utilice una máscara. Estamos pidiendo que no utilice máscaras médicas, no utilice máscaras, si puede, si tiene acceso a una máscara hecha en casa. Esta me la hizo alguien, me la regalaron, y pues es muy bueno porque está hecha de tela, y no queremos que los trabajadores médicos se queden sin máscaras. En Nueva York han estado utilizando los trabajadores médicos este tipo de máscaras, y le tenemos que guardar las máscaras hospitalarias para esos trabajadores. Entonces, use máscara, y si puede, intente hacer una o comprar una, pues no médica. Puede ver información en readyharris.org de cómo lavarla, dónde comprarlas, todo esto. El recurso que estamos anunciando hoy realmente me enorgullece muchísimo, lo estamos anunciando con el alcalde, con varias organizaciones, y es que ya hemos visto pues, que realmente no hay suficientes trabajadores médicos a lo largo del país para manejar este tipo de virus. Entonces, no podemos permitir el que haya un solo trabajador médico, un solo trabajador de supermercado, trabajador esencial en casa, simplemente porque no tienen dónde dejar a los niños. Y queremos que todos los trabajadores esenciales que necesiten cuidado infantil tengan acceso a cuidado infantil y que todos los trabajadores esenciales que hayan encontrado ya cuidado infantil lo puedan pagar. De eso se trata el esfuerzo del día de hoy. Entonces, si usted es un trabajador esencial, puede ir a readyharris.org, ahí encontrará el link donde puede aplicar y lo conectarán en cuestión de un par de días con el Centro de Cuidado Infantil licenciado cerca a su hogar o donde usted desee, y si califica para ayuda financiera, también se le conectará con ayuda financiera. Ahora, no es necesario que usted sea ciudadano americano. Si su hijo es ciudadano americano, hijo o hija, también puede calificar para el apoyo, inclusive la ayuda financiera. La información está disponible también en español en readyharris.org. Entonces, invito que utilicen este recurso. Lo que queremos es reconocer que estos trabajadores esenciales están apoyándonos a todos y nosotros queremos apoyarlos a ustedes. Estamos trabajando con los centros de cuidado infantil para asegurarnos que estén tomando medidas de precaución para no exponer a los niños, por ejemplo, recibir muchos menos niños de lo que es la capacidad, utilizar las medidas que recomienda el gobierno federal para saber que estos niños van a estar pues tan seguros como es posible. Finalmente, tenemos otra nota, es una pregunta que recibo muy seguido. ¿Qué estamos haciendo para apoyar a las personas sin hogar? Decimos que todos deben estar en la casa, que deben estar en cuarentena, pero ¿qué si no tenemos casa a dónde ir? Y tenemos ya ahora una solución. Desde este sábado en sociedad con la ciudad de Houston, con el alcalde, hemos estado trabajando en un programa que ya está establecido para recibir personas que no tienen casa. Entonces, si alguien no tiene hogar y ha sido diagnosticado con el virus o tiene síntomas y es muy posible que tenga el virus, los conectaremos con una entidad donde estamos recibiendo a esas personas sin hogar, les estamos ofreciendo todo tipo de servicios para que estén bien. Hemos trabajado con los hospitales, hemos trabajado con los centros de apoyo a las personas sin hogar, los albergues, y de esa manera los estamos apoyando para que tengan también los recursos que necesitan. Otra nota muy breve: empezarán a ver camiones en el centro de NRG, donde solía estar el rodeo. Ese es un centro del condado. Y quería solo informarle a todos que empezando el día de hoy se empezarán a ver camiones ahí porque estamos construyendo ya el centro médico que es de último recurso. Entonces se trata si los hospitales realmente se ven en una situación como la que hay en Nueva York u otras ciudades donde no tengan camas, no tengan espacio y ya hayan maximizado pues su capacidad en cuanto a áreas comunes, pasillos, todo eso. Entonces en ese momento se utilizará lo que estamos construyendo en NRG, lo estamos construyendo en el estacionamiento porque los edificios todavía tienen materiales del rodeo, lo cual sería un problema para los pacientes con temas respiratorios. Esto, como he dicho, esperamos no tener lo que necesitar y por ahora también estamos evaluando qué otros usos se le pueden dar. Por mientras esperamos a si se va a usar o no para esto de último recurso. Aquellas personas que han estado preguntando si pueden donar comida para distribuir comida al Houston Food Bank. El Food Bank está pidiendo el favor que por favor no donen comida, sino donen dinero. Así ellos pueden invertir esos fondos en la comida que más necesitan. Entonces recuerden, pueden acceder donaciones en Ready Harris, pero también el día de hoy quiero prestarle especial atención al Houston Food Bank, el quien ofrece comida a nuestra región, a nuestros niños. Entonces vayan a houstonfoodbank.org, donar fondos que harán disponible la comida para la gente que la necesita. Y una nota muy breve para terminar acerca de la cárcel. He explicado ya que cruzamos más de 1,000 personas, 1,300 ahora que tienen el virus. Otra cifra que hay que explicar es que ya vamos en más de 10 personas, 10 trabajadores en la cárcel que tienen el virus, que han sido diagnosticados. Más de 3 presos ya tienen el virus y hay más de 3 personas en la cárcel, más de 3 docenas de personas en la cárcel que tienen síntomas, y esperamos que lo más seguro es que llegue esas pruebas positivas. Hay más de 800 personas en la cárcel que están en cuarentena, a como mejor lo hemos podido diseñar en una cárcel que pues está muy apretada de personas. No necesitamos ser doctores ni tener un doctor aquí, aunque ya lo hemos tenido, para explicar que la situación de la cárcel es muy peligrosa. Hay 8,000 personas que viven en contacto extremadamente cercano, y si esas personas se siguen contagiando de la manera que está sucediendo, estos individuos, sean trabajadores o sean presos, van a necesitar la misma camilla de hospital que usted y yo podríamos necesitar. Es por eso que evaluamos personas no violentas, de bajo riesgo, nada de violencia doméstica, nada de eso, sino personas no violentas, acusadas de crímenes no violentos, para poder aliviar la presión en la cárcel y que haya más espacio para que no se esparza el riesgo del virus. Por eso estoy realmente muy impaciente en cuanto a qué vamos a hacer con la cárcel. Yo pienso que realmente la historia nos va a recordar de 2 maneras. Aquellos que actuaron de una manera agresiva, creativa, para detener el contagio del virus, y aquellas personas que actuaron lentamente o peor, se pusieron en el camino para prevenir que otras personas tomaran acción agresiva innecesaria. Y espero que todos nosotros estemos trabajando por tomar acción. Me preocupa mucho que no se vea en este momento progreso en el tema de la cárcel. Dadas estas cifras, he recibido yo personalmente comunicaciones de las familias de los trabajadores de la cárcel, trabajadores médicos, trabajadores de seguridad pública, que nos dicen están realmente muy preocupados de ver cómo están incrementando los casos y de ver que no se está pudiendo llevando a cabo el progreso que necesitamos ver. Entonces, con eso termino. Van a hablar más personas, después estaremos respondiendo preguntas, y nuevamente muchas gracias a todos los que están poniendo de su parte para ayudar a que controlemos este virus. Thank you so much.
Thank you, Judge Hidalgo. And as the mayor and the judge described, there's an importance of us working together and unifying both local, state, and national partners. And next, we'd like to have the Honorable Congresswoman Sheila Jackson Lee provide some words. So sorry, she's on the phone. So let's go ahead and have Dr. Melanie Johnson from Collaborative for Children come and describe more about her fantastic organization and find childcarenow.org.
Good afternoon. Collaborative for Children is so pleased to insert its resource, findchildcarenow.org, to help those in our community who are doing so much on the front lines to keep us surviving and thriving. We have had this resource for several decades, and we've been able to refer tens of thousands of families, specifically parents, to quality child care. And we are so pleased to be able to join hands with the federal agencies, with Workforce Solutions, with our mayor of Houston, and our county judge, Lina Hidalgo, and with Houston Endowment's support to undergird this partnership. We're super excited about this opportunity. For now, parents are able to use this website not only to refer to quality, accredited, and licensed childcare, but also be able to receive funding, subsidized childcare through an application process with Workforce Solutions. So we're very grateful for that. And for those of you who are parents who are concerned about COVID-19 and the cleanliness and the sanitation and the safety of your little ones in the child care centers, well, child care centers have historically dealt with cleanliness and sanitation and hand washing and things of that nature. But Collaborative for Children has certainly ensured that they receive information directly from the CDC in terms of COVID-19 protocols and guidelines for sanitation. So we will ensure that, and we will consistently do so, but our goal is to make sure that parents of essential workers or parents who are essential workers are able to get financial assistance as well as find quality childcare, or both, on findchildcarenow.org's website. We also want you to know that in this critical time, it's not just essential for us to find childcare and provide subsidies, but children, specifically those ages birth through 5, need very much to have a consistent learning environment so that they are ready for school. At present, only 47% of our children enter school ready, and our staff at Collaborative for Children is working behind the scenes remotely in order to provide the type of school efficacy that is necessary for these children to enter school ready in the fall. In the aftermath of Hurricane Katrina, we saw that it took about 2 years for school children to be able to recover lost learning. And we do not want that to happen to children in our county and in our city. So Collaborative for Children has provided not only this website, findchildcarenow.org, for affordable childcare, but also for actionable items to ensure that our children are ready for school. Thank you very much.
And now from the Gulf, we'll go ahead and ask the Congresswoman Sheila Jackson Lee to please provide some words on behalf of the community.
Good morning. Thank you very much. Let me thank the Mayor and County Judge, Texas Workforce Commission. Texas Workforce Commission is a partner with the U.S. Department of Labor and federal funding, and we could not be more appreciative of this giant step. We thank you to the Mayor's leader on education, Dr. Johnson, and those who have gathered here in particular. I was just on a phone call with the members of Congress on the discussion of CARES Act number 3, and that is the next step of federal funding. Listening to the efforts here, we know that the focus is going to have to be on refining and improving and funding the unemployment, since we know that 6 million persons across the nation have filed for unemployment and large numbers in this community. And so listening to our leaders, we are able to ensure that federal funds will come from parents who are unemployed, and to provide child care block grants to our local communities that will further help those who have to go to work and need child care. And so we want to be a partner, and I am glad to be able to offer this advocacy in Washington along with my colleagues to emphasize the important work that is being done here. I want to thank the Houston Endowment, and I want to acknowledge those child care facilities that are maintaining their open space. I want Dr. Johnson to know that she is right, that when I've seen child care facilities, they are impeccable with their efforts at cleanliness. I think that should be an important point. I know that in my own congressional district, there are many, including the Barbara Jordan Center, that'll be open to individuals who have to go to work. So however we can be a partner with the federal funding, we also appreciate the private donations that are going to be able to help this opportunity of individual parents getting assistance, but as well being able to sign up at childcarenow.org, if I have the right, I've got it right, childcarenow.org. We hope that the parents will sign up. As I drove here today, I saw the many truck drivers and deliverers. One of them, I opened the window to say thank you for your service. We don't get a chance to see all of them. We may see the grocery persons and those who are stocking shelves, but we don't see every one of the essential workers. They have families too. And I think it is extremely important that we recognize in this time that we are our brothers and sisters' keeper, and that we are in fact there to take care of each other and to say thank you. I want to close my remarks by indicating earlier today, a group of us took a moment of silence for those who have lost their lives, and we don't want the loved ones to think that we have forgotten them. Again, let me thank our local leaders for the very difficult work that they're engaged in. Let me commit that our bipartisan congressional delegation is here for you. Mikase Sukasa, we are all in this together. Your house is my house. Thank you.
Thank you, Congresswoman. And now on behalf of the Gulf Coast Workforce Board and Workforce Solutions, Mr. Richard Shaw.
Thank you, Juliet. Thank you, Mayor Turner, Judge Hidalgo, Dr. Johnson, Congresswoman Sheila Jackson Lee. On behalf of the Gulf Coast Workforce Board, it is my pleasure to welcome you to Workforce Solutions North Line. Here you are. And standing behind me to my left in the back is Mark Guthrie. He's the chair of our Gulf Coast Workforce Board, and we welcome you. You see that the office is empty, and that's because our staff is working remotely. Nearly 1,000 professionals remain ready to help with job search, job matching, career counseling, and adult literacy advice. And our employer service team is helping businesses find qualified candidates and manage their workforce needs using phone, email, and the internet. We thank Mayor Turner and Judge Hidalgo for their leadership and for lending their voices to tell essential workers that we value their efforts and are here to help. Since its inception, the Workforce Board has placed a priority on and invested its funds in improving the quality of early education and care. Collaborative for Children is and has been our partner in this effort. As the largest single payer for early childhood education and care in the region, the Gulf Coast Workforce Board has for more than 20 years worked to expand the availability and quality of early education and child care for our working parents. With an initial allocation of $10 million, the Gulf Coast Workforce Board will provide financial assistance that will enable quality early education and care for the children of essential workers across the entire 13-county Workforce Solutions service area. Currently, the board supports 30,000 children and their families with education and care expenses every day. This additional investment will help ensure that an additional 6,000 children are in safe and quality learning environments while their parents serve our communities as essential workers. In everything we do, the Gulf Coast Workforce Board seeks to assure that the Houston-Galveston region remains a great place to live, work, and do business. With this investment, we honor the everyday heroes who are helping our community remain safe and functioning during this unprecedented crisis. Please visit findchildcarenow.org to start your application, and you will be contacted within 2 business days. If you already have children but need financial assistance, you can call us directly at 713-334-5980. Thank you.
In closing, my name is Juliet Stepetch, and I'm Mayor Sylvester Turner's Director of Education for the City of Houston. It's a distinct honor and a privilege to be able to collaborate with these leaders who love our essential workers and their children. And so we know that we are stronger together, though we are apart at this point. And this is a unique demonstration of how working together, successfully braiding public and private dollars, we can guarantee and ensure that we are going to offer childcare resources to persons, critical information at this time. And we just want to thank you for sharing this news with the community and ensuring that this news gets out there to everyone, that it is available and it is being launched today. And with that, we will open it up for questions.
We just had a nurse call us saying they tried to get on the website, and I guess they called a couple of the daycares on the website, and they were telling them that they didn't take
Yes, the portal is there for the registration, findchildcarenow.org, and then we have a caseload of caseworkers who will assist them with matching them with their child care needs. So not to call the centers directly. Correct.
Judd, what can you tell us again about what's going on at NRG? More specifically, like the hospital lot resort, that facility, or what's the status of that?
So we've all heard about the importance of our hospital capacity, that we have enough ICU beds, that we have enough ventilators. We've seen in New York, for example, right now they're scrambling to build a field hospital in Central Park. You know, everybody's trying to add on to those beds. We don't want to be in a situation where we're trying to build something in the middle of an even deeper crisis. And so what we have decided to do is get ahead of this challenge and start building a last resort medical shelter now. So the structures are coming up this week, and it will have capacity. We're still trying to figure out, we're building it by modules, so it's 250 bed modules, and we may be able ultimately to build at least 3 of those. The first one will come up this week, and those will be used and activated once the hospitals run out of space, not just of their normal hospital beds, but also of their surge hospital beds, because we have to make sure that we are absolutely maximizing capacity. So we can't step in before the hospitals have reached their capacity. Otherwise, we're ending up with less capacity than we could have actually built. The other note I made is we're trying to assess, you know, in the meantime, could we be using those beds or that space for something else obviously related to coronavirus? And so those are the questions we're asking, and to the extent that we find a solution, I'll share that with the community. They will be built in the parking lot. Obviously, it's all done according to the best engineering and healthcare advice, just as it's been done in other communities. These outdoor spaces end up having better outcomes. But the biggest issue is that it would be a respiratory challenge for folks if we put it inside NRG. That said, you know, the experts all tell us, and as we've seen in other communities, there are perfectly great designs to build these outdoor medical shelters. You know, folks call them field hospitals in other places. It's not something that we're, you know, inventing. It's something that there's a design that exists, it works, and we're establishing a shelter in NRG so that we have that if we were to need it. And let's hope we don't, because if we get to a point where we're using those beds for coronavirus or for to offload the coronavirus needs of the hospitals, then we know that it's truly a challenging place.
Judge, along that, the staffing, is there plans coordinating right now with the medical center about how you would staff this field hospital?
Great question about the staffing. So yes, the idea is to bring outside staff, so we're not having to pull from existing medical center staff that's already been, you know, stretched thin. And so yes, we're working on staffing as well. The idea is to have it ready to go so we don't waste a single second were we to need this resource.
And the resource for creating this space, is that an outfit that has done this? Is it a contractor that's coming in who does this?
Yes, it's a contractor that's building the space. The name, I have it, I don't want to say it wrong, so we'll follow up, but it's a contractor that has experience building this, and they had one medical shelter available, and we were able to snatch it up. As folks will recall, the federal government was offering, you know, field hospitals. The Texas one went to Dallas, so we weren't able to bring it. We were still concerned, and I was concerned. We've had this discussion with the mayor and other community leaders. You know, we have got to have this resource, and so we were able to find a contractor that will build it, and ideally, we heard back from our federal partners that they would reimburse us for these expenditures at 75% cost. So that's great. So right now, you know, the county is fronting that, and we hope to be able to receive the federal support, which they've already said, you know, if we use it according to these parameters, that they would reimburse.
Do you have another question on that? On that issue?
I have lots of questions.
Okay. You're also, you mentioned the inmate situation. Is there an appeal going on or a plan to appeal Judge Ritchie's order to try and get that, your decree back in action?
Yeah, so where we are right now is we had for quite a few days, perhaps at least a week, been in discussion before the order came through as to making sure that we were releasing nonviolent inmates through a careful process. As I mentioned when I initially signed the order, the sense is we don't have time to wait. That wasn't done, and so I signed the order. It's neither here nor there to me who does it, as long as it gets done. That was my initial comment, 10 days, 2 weeks ago, to all of the stakeholders involved. And so the challenge is we have two conflicting orders. We certainly could resort to legal action around this for a court to decide which one controls. The problem is we don't have time for a protracted legal battle. We don't have time. And that's why I've not given the go-ahead that we engage in that battle in the hopes that today we will see some action. As I said, it is time to either act or let others act. No other option. Because this is about health and safety. Releasing nonviolent folks, people accused of nonviolent crimes, is not a proud political slogan for anybody. I'm taking this step, and I signed that order because every day we have more people who are sick. We had over 24 people last week with symptoms who were likely ill. Now we have 36. There's 8,000 people, and those folks are gonna need your hospital bed, my hospital bed. And so the sense is we designed a very careful, thoughtful process to assess anybody before they were released, to ensure they wouldn't be released into homelessness, that they wouldn't be released if they had COVID symptoms, that we didn't release anybody with violent histories, that we all evaluated it very carefully, and that would have released about at most 1,000 people over 3 days. That's the kind of speed we need. We've already wasted an additional weekend, another few days. More and more workers are now have the virus, and so that's my plea. And yes, we may have to go to court for this, but we don't have time for that. We just don't have time for that.
So does that mean you're reaching out to the judge to work to find an arrangement that he can approve, or you're looking for a workaround?
Right now, as we have from the very beginning of this process, from well before I signed the order, I've said, look, if y'all want to do it, go ahead. Now, the judges have the list of inmates that we'd already, been assessing. They've got the charges that we'd evaluated and agreed on with all the stakeholders. They have it. And so if they want to act, they can. They stopped me from acting. And so again, act or let people act. But don't put us in paralysis that literally threatens lives, not just of folks in the jails, be it workers, be it inmates, but those of us who are going to need those same hospital beds.
Am I supposed to hold this? I was going to ask the judge and the mayor, specifically if you guys had some better statistics on what percentage of our current hospital surge beds are taken, or like how many people are hospitalized for COVID and how many are in ICU for COVID. We still don't seem to have any sort of concrete information on that. Mayor?
Yeah.
Let me just do it, and I'll get back. If we can do this, if there are no other questions on the child care initiative, are you all finished with the child care initiative?
Well, the main question I had on the child care initiative was the clarification, I think, and I don't know if you want to say anything about that, because I think what we've gotten is people like calling right away.
Yeah, let me clarify real quick and then answer the question briefly. So in terms of the child care initiative, go to the website right now. You can see it on readyharris.org or childcarenow.org, and so there you will be set with a case worker who will connect you to the resources, because we want to make sure we're pairing folks, and you'll be able to issue a geographic preference. You can apply for aid. So the idea is to fill out a form that's on the website. So right now we're not asking folks to go and find their child care themselves. It's less efficient. You can certainly try, but the system we've set up is an efficient system through caseworkers, so we can pair folks with the resources. On the question of the case count at the hospitals, as I said, and I've said before, it is very important for us to be in constant communication with our hospitals as to what numbers they're seeing, because that is truly the best accounting we have of the growth in the cases. I can tell you guys the latest information we got from the regional organization from CETRAC is the hospitals are about 70% occupancy right now. Now the key number is not so much that, but how quickly the cases are rising. And from separate conversations we've had from the different hospital leaders, these are still growing at an exponential rate. We are working to synthesize the information across the hospitals. It depends on us getting information from individual hospitals. That's the challenge. And so that's the information we're still seeking out. But where we are right now is that 70% capacity across the board roughly, and the numbers still growing in a path that tracks, a New York type thing. And so we're still early on that path, but we are on that path.
And
Yes.
do you know how many county employees, because I know the mayor has talked about city employees who have tested positive, other than the sheriff's folks? Because I understand, I'm hearing that some folks at Harris Health, like in the call center, tested positive. And so do you know how many of your non-uniformed employees are positive, and are you guys mitigating that?
Last I heard and checked in with my folks about that, it was the law enforcement folks that we have a good track on. Other county employees we hadn't confirmed, and so I will go back and confirm, and that's the kind of information, the minute we have it, we put it out with our 4 o'clock release, and so we'll circle back on that. But last I heard, it was just the law enforcement. Mayor, yeah.
So I just want to reiterate, please visit findchildcarenow.org and register. Don't go in. You can go in and look at different sites on the mapping of current childcare, but to go through the process for essential workers, register. You will be contacted by Collaborative for Children, a specialist, within 2 days, and you will be contacted by Workforce Solutions if you are seeking financial assistance within 4 days. So please do that, follow the procedure. If you just go online and start searching, you will run into that issue. So follow the process and you won't run into that issue. Any other questions regarding the child care before we allow those folks that are a part of that discussion to be released? Seeing none, we will continue the conference with other questions.
Yes, I had some more questions. Mayor, are you going to be able to answer any other COVID-related questions?
The mayor has a 3 o'clock
Okay.
briefing at City Hall, and he'll be available at that time. Thank you.
Okay, Judge, the